I am going to talk to you today about my career in health psychology and public health. I'm Professor Angel Chater, Professor of Health Psychology and Behaviour Change at the University of Bedfordshire. I'm also the current chair of the British Psychological Society Division of Health Psychology and the past chair of the Behavioural Science and Public Health Network, which is formerly called the Health Psychology and Public Health Network. And I'm the co-founder of the Health Psychology Exchange. So my education started in Luton in 1994. I did psychology, sociology and human biology A-levels at Luton Sixth Form College, and then went on to the University of Luton, where I did a BA Honours in psychology and an MSc in health psychology. That followed a PhD in 2002, where I studied children's health perception and health behaviour, looking at an intervention approach under the supervision of Professor Klaus Vogler and Professor Marcia Worrell. I was heavily interested in white papers and policy documents on the health of the nation, saving our lives, our healthier nation, and looking at how we can promote a healthier living and reduce inequality in health. In my foreword for my PhD, I highlighted that information alone is not enough to change behaviour, that human behaviour is much more complex, and that health psychologists working in the implementation of interventions for health promotion were infrequent and few, so more work was needed. My PhD focused on public health policies and a theoretically driven behaviour change intervention, bringing many different psychological theories together to develop a modified theory of planned behaviour. I looked at physical activity, eating behaviours, smoking and alcohol, and the evidence that we have now is substantially grown compared to where we were back then. And I followed Susan Mickey's career very closely over the last 2 decades and the development of things like the behaviour change wheel and COM-B, which, my God, I wish it was developed back then. At the end of my PhD, I was really interested in POST, which is the Parliamentary Office of Science and Technology. The BPS had a joint award, a secondment to POST, to help to support the development of post notes, which I'd used quite a lot in my PhD, which are short briefings that they give to the MPs in House of Commons, the House of Lords and UK Parliament. I was shortlisted to the last 2 for this secondment. I didn't receive it, but my passion for working within policy and practice continued. During this time, I was also gathering competencies for my stage 2 training, and so I gained employment in teaching and training. My passion for health psychology and public health continued, and I began to do hourly paid lecturing to build my teaching and training competency for stage 2. This led to a lectureship in health psychology at the University of Bedfordshire, which had renamed from the University of Luton, and I developed and coordinated an applied health psychology unit at level 6, which is year 3 undergraduate level. And I had 6 MSc health psychology units, one of which I'd adapted from epidemiology to a unit on public health, which included epidemiology and sociology and anthropology, but predominantly intervention designs in public health. I also rewrote, validated and accredited the MSc in health psychology and developed an MSc in physical activity, nutrition and health promotion, which was a cross-faculty MSc with the sports science department, along with another in dance science. These were non-psychologists and I was teaching them psychological approaches to public health and professional skills, such as communication skills. In 2008, I was promoted to senior lecturer in health psychology and I began to lead the MSc and BSc as course director. Also during this time, I had part-time work in consultancy at the Luton and Dunstable Hospital. I was giving a public lecture and the manager for the L&D Hospital Centre for Obesity Research was in the audience, and she came up to me afterwards and asked a bit more about health psychology because they hadn't heard of it before. I had a meeting with her and a couple of the surgeons, and they agreed to change the service level agreement from from clinical psychology to health psychology, so they could employ health psychologists. I became their health psychologist specialist obesity services, and I worked within a multidisciplinary team to work with bariatric patients and individuals with a BMI of 35 and above with a comorbidity such as diabetes or sleep apnea. What I noticed was many of the others in the multidisciplinary team, so the nurses, the dietitians, the exercise physiologists, lacked the core behaviour change skills that we would hope people would have to support behaviour change. So they would often tell people what to do rather than bring it out of that individual themselves. So I realised there was a more needed in terms of research, training and policy. So I began to focus my efforts on obesity research. I looked at behaviour change through communication skills and the power of language and the way in which we communicate with individuals in these settings. I looked at behaviour change techniques that have been used in effective and ineffective obesity interventions. And I also looked at positive psychology and happiness and how we can harness people's character strengths when we are working with weight loss interventions. I then took this science into practice on a community-based physical activity programme for individuals who were at risk of cardiovascular disease or mental health, predominantly individuals who had obesity or diabetes. And this programme was called Active Hearts, which was run out of Hertfordshire. It was sponsored, funded by Sport England and Hertfordshire County Council, along with several other stakeholder partnerships. And we used our research on behaviour change techniques for effective behaviour change for physical activity, along with how to use the COM-B, which is the hub of the behaviour change wheel, to be able to do behavioural diagnoses with individuals on their capability, opportunity and motivation. And we trained the registered exercise professionals who were delivering this service in motivational interviewing, health coaching and behaviour change. This led to policy development, guidelines and dissemination and impact. I was involved in co-writing the BPS policy document for psychological perspectives on obesity, which was addressing policy, practice and research priorities. And Active Hearts featured within this, along with some of my other research. Active Hearts has been used by the Local Government Association as a case study for best practice, and it's been used by Sport England in their behaviour change design principles. I've presented at the Cheltenham Science Festival to a lay population to support understanding obesity and weight management. And I've spoken in the House of Lords and the House of Commons in Parliament at an all-party parliamentary group on behaviour change and the importance of language and understanding behaviour to support obesity, and also a roundtable supported by Slimming World to harness the importance of the language that's used by healthcare professionals. I've also been interviewed by Tanya Byram for the BBC One documentary on the truth about improving your mental health, which was aired in January of this year. And you can see in this picture, I'm teaching Tanya how to do a COM-B behavioural diagnosis. And it also featured one of our Active Hearts participants, Brenda, and one of our Get Active specialists, Alison. Our Active Hearts programme has been replicated in other local authorities, including Luton, Epping District Forest and Watford. And the headliners from our report was that obesity is not a choice. It's not simply down to a lack of willpower, that behaviour change is central to the prevention, management and treatment of obesity for individuals, groups and entire populations, and that obesity is not a behaviour. We can't change obesity overnight. We need to work on behavioural change to be able to support changes in outcomes. This received widespread media attention and was in many of the newspapers, along with interviews that I gave both in the UK and as far as New Zealand. And our key message was that we need to avoid stigma through the language that is used, through the way in which services are delivered, and that psychology is central to being able to support individuals living with obesity and those working with them. So back to my employment and teaching and training, and one of my key things I've learned is talk to people while in transit. In 2011, I went to my first European Health Psychology Society conference, as I'd become the UK national delegate for the EHPS, which I took over from Martin Hagger. I met a man on a bus and he became my boss, no word of a lie. He asked me what I did and I gave him my kind of 2-minute spiel as we were on our way up to the conference dinner. And he said, "Oh, I really like that. We've got a job coming up, apply." And a year later, I began my lectureship in health psychology and behavioural medicine at the UCL School of Pharmacy, as this guy was Professor Rob Horn, who was an international expert on applying health psychology and behavioural science to a pharmacy setting, and he was the lead for the School of Pharmacy and the Centre for Behavioural Medicine. I developed a module applying health psychology to pharmacy, and I also linked closely with the newly emerging UCL Centre for Behaviour Change led by Susan Mickey. I helped to write UCL Centre for Behaviour Change MSc modules and became a tutor to the CBC and an associate, which I still do to this day. Also during this time, I was doing a lot of academic citizenship. It started as the Division of Health Psychology representative for SIPAG, which is the Psychology Postgraduate Affairs Group. I then became the Consultation and Specialist Knowledge Coordinator for the DHP, which again, I think I took over from Martin Hagger. And this saw me receive consultations from NICE and Department of Health and many others, and to find health psychologists to respond to those consultations. I then became the Publicity and Liaison Chair, where I was supporting the development of leaflets and press releases around health psychology and how it can be applied to areas like public health. And then I became the Division of Health Psychology Chair. Also, I've already talked about my role as National Delegate for the EHPS, and I then was a co-founder for the Health Psychology and Public Health Network. So health psychology and public health has some history. In 2003, Susan Mickey and Nikki Ramsey were seconded to the Department of Health to give psychological input to white papers that I was reading in my PhD, like the Choosing Health white paper. There was a series of NICE guidance consultations on behaviour change, which I helped respond to, the BPS response, which again was led by Susan Mickey. And in 2008, Scotland managed to secure funded stage 2 training through NES, which was led by Vivian Swanson. And they have funded over 35 trainees to this date. There's been House of Lords Science and Technology Select Committee on Behaviour Change, and in 2013, Public Health England created the Behavioural Insights team. In the same year, myself, representing Division of Health Psychology, and Professor Jim McManus, representing the Faculty of Public Health, came together to develop the Health Psychology and Public Health Network. And we had a small committee that helped us to continue the agenda of bringing health psychology and public health together. There was a clear need to build capacity in health psychology at this time, and how it can be applied to public health. In 2011, I'd wrote about my desire to create an East of England hub that brings health psychology to the public health arena. And in 2016, Jim and I wrote about how we had done this through the Health Psychology and Public Health Network. So the network is a national network which brings together people with an interest in health psychology and public health. It offers networking opportunities, conference, CPD events, a newsletter, blogs, a website, podcasts, and so on. Our aim was to bring people in academia, practitioners, in public health, commissioners, policymakers, all in the same room to learn from each other and share best practice. We also created honorary fellowships, and we invited champions in both fields like Susan Mickey and Mary Johnson in health psychology, and Duncan Selby and Kevin Fenton in public health. And our committee in the onset was heavily formed by my former MSc students or PhD students in health psychology. Early in 2014, we convened a health psychology careers masterclass, and we had speakers such as the chair at the time of DHP, Professor Paul Bennett, and one of my former PhD students, Dr. Erica Cook. We then had another workshop on the role of health psychology in public health, which myself, Michelle Constable, and Jim McManus convened, and was led by Professor Falco Sunita, and had sessions again from myself and Erica. There was a tendering opportunity to create a behavioural science-led approaches to public health unit through Hertfordshire County Council, which myself and Falco Sanita tendered for, but unfortunately the funding globally was pulled from local authorities, but we continued our mission anyway. So in September of the same year, we held a symposium at the Division of Health Psychology on improving the health of the nation and health psychology's role in public health. The workshop was so big they had to take a divider out of the room because so many people wanted to come. And we ended on a pledge to embed health psychology into public health in everyone's work that they were doing. By the end of this year, we'd developed the constitution for the network and formalised our committee roles. For the next few years, I travelled across the country to promote health psychology and public health. I went to the 4 nations of the UK, along with many areas in England, many of which have now become regional hubs. And I lugged the banners that we had to promote the network with me on my little suitcase, often on trains and aeroplanes. We had a call to action to introduce what behavioural science was and how it can be utilised in public health. And with the support of Public Health England, we led a webinar on the application of behavioural science in public health, which was specifically requested by the Association for the Directors of Public Health. They wanted to know, what is this behavioural science and how can we apply it to our work? So myself, Michelle Constable, Jim McManus, Tim Chadbourne and Amanda Bunton, who then at the time was the SIPAG representative for the DHP, the policy representative for the DHP, Michelle was the SIPAG representative, we then created and delivered this webinar. This then led to the development of the Behavioural and Social Science Strategy for England in September 2018. And as part of this strategy, we agreed to rename the network, the Behavioural Science and Public Health Network, to widen our remit and to host the strategy to support its implementation. And part of that implementation was to develop hubs, regional hubs that could have CPD events across the country at a more localised level to help support achieving behaviour change. And then UCL and PHE created their guide for local government, which also features our Active Hearts programme. We created a journal-style publication and podcast to facilitate the translation between health psychology and public health. And this way it was going both ways, not just health psychology in public health, but how we can learn from public health also. And I'd asked Catherine Brown to lead on the publication and Stuart King to lead on the podcast, and both of them have done an amazing job and continue to do so. Internationally, I had travelled over to Moldova as an invited speaker for an event with over 100 politicians and policymakers and practitioners on how to do evidence-based policy making for health promotion to reduce the burden of non-communicable diseases in Moldova. The key message that I gave was players in behavioural science and public health need to work together. I used Active Hearts and the network as examples of this, and they translated while I was speaking on stage in Russian and Romanian, which must have been a really hard task because I speak really quickly. So what do I do now? I continue to talk to people in transit. I met a man in a shared taxi this time, and now he's my boss. This was at a University of West England external examiner event. It turns out he was based in the sports science department where I had co-written previously the cross-faculty MSc in physical activity, nutrition and health promotion. So I rejoined in 2016 as reader in health psychology and behaviour change after he had highlighted they had a job coming up, and I redeveloped that MSc to now focus on behaviour change. I also developed a unit in behavioural science and public health and applied health psychology in public health. And last year in lockdown, I became a professor in health psychology and behaviour change. I now lead the Research Institute for Sport and Physical Activity Research, which hosts these amazing people. I have a set of staff who work within the Institute, and I support them. I support them with their research, and we have over 35 students who do research within the Institute who I also support. We have received funding from a number of different organisations, and I'm involved in a number of different research projects. But the majority of my research is looking at how we can use physical activity to either prevent or treat long-term conditions, and in particular, obesity, diabetes, and mental health concerns. And here's some of the examples of our funders and the projects that I'm involved in. I've also done a lot of work during COVID-19 at bringing health psychology into public health. We have a case study for mobilised voluntary expertise through the Behavioural Science and Disease Prevention Task Force that I lead, and the Health Psychology Exchange, which I co-developed with my colleagues and good friends, Professor Jo Hart and Professor Lucy Byrne-Davis. Everybody on this slide has offered their time voluntary over the last year, considerable amounts of time, to help us to develop evidence-based guidance documents to support the translation of health psychology into public health. It's based on evidence of rapid reviews and expertise, and we have helped to inform SPI-B and SAGE and many other organisations and public health teams. And our aim was to build capability, opportunity and motivation of those working on the ground in public health, commissioners and practitioners, to use behavioural science and health psychology to support the global pandemic. We've seen directors of public health, such as Greg Fell, who is based in Sheffield, use our guidance verbatim, and he's worked very closely with one of our team members, Professor Maddie Arden. And we've worked with companies such as Lifebuoy, doing some consultancy work based on our hand washing guidance on how to promote hand washing to the wider population. The ultimate goal is to create health psychology champions. We've created health psychology career case studies with over 64 careers of health psychology, led by the Division of Health Psychology team, which are all in this picture at the bottom. The ultimate goal is to optimise the success of the Scottish health psychology training model to create funded health psychology training and to create these champions, which we now have received funding for some. We want to build systems and networks to develop a psychologically informed government and workforce to optimise how to use health psychology for positive health outcomes. So some career advice. Know your elevator pitch. You never know when you might need it in a bus or a taxi. Identify your own unique selling point. When opportunities come up, jump at them. Think strategically and think about the long game and enjoy that journey. But also ensure that you look up. Spend time with your friends and your family along the way, because I began my A-levels pregnant, and my daughter is now 26. I was pregnant during my master's degree, new baby during my PhD, and my son is now 19. So please enjoy your life along the way. Good luck in your careers. I hope you've enjoyed listening to mine.